Hello, and welcome to the Pharmacy Times News Network. I'm Ashley Talamo, publisher of Pharmacy Times, and your host for our Pharmacy Week in Review. The National Association of Boards of Pharmacy recently revealed that about 96% of online pharmacies are non-compliant with federal and state laws or pharmacy practice standards. The majority of these online pharmacies were dispensing medications without valid prescriptions, and almost 12% were providing controlled substances. NABP Executive Director Carmen Catazon told Pharmacy Times that pharmacists in brick-and-mortar stores can play a significant role in educating patients about these potentially dangerous websites. He said pharmacists can warn patients about online pharmacies that do not list a physical address and also advise patients to steer towards sites that are licensed in their states. After that, he said the overall best advice is that if something sounds too good to be true, then it probably is. The FDA has approved Sprout Pharmaceuticals' Addyi, a pink pill described as female Viagra. Addyi is the first drug to treat generalized hypoactive sexual desire disorder in premenopausal women. This condition is recognized among women who previously had no problems with sexual desire. Because of the risk of severe hypotension and loss of consciousness, pharmacies can only provide Addyi if a patient has a prescription from a certified prescriber, and pharmacists are responsible for counseling patients about the importance of alcohol abstinence. The FDA has expanded the use of powerful painkiller OxyContin for children as young as 11. The opioid is now indicated to treat chronic pain in ages 11 to 16, after studies from drug maker Purdue Pharma proved it's safe for the pediatric population. Before receiving OxyContin, children must have already been treated with an opioid and also tolerate a minimum dose of at least 20 milligrams of oxycodone. The FDA reminded parents of young patients taking OxyContin to store it securely and dispose of it properly after it is no longer needed. An alarming 50% of teens aren't properly educated on OTC medications, potentially leading to dangerous misuse of these drugs. Ray Bowman, Executive Vice President of the National Council of Patient Information and Education, told Pharmacy Times that these knowledge gaps could have harmful consequences. In the absence of school interventions, Bowman said pharmacists can play a very important and visible role in the community promoting safe OTC use among teens. That's all for the Pharmacy Week in Review. For more great coverage and practical information for today's pharmacists, visit our website and sign up for our daily e-news. And don't forget to follow us on Facebook, Twitter, and Instagram. I'm Ashley Talamo at the Pharmacy Times News Network.